So good morning, and thank you so much for the opportunity to come and talk to you about the work that we are doing around communicating the importance of dairy foods for older Australians. My name is Dr. Rivkeh Haryono, and I am a senior scientist at Dairy Australia. And I'd firstly just like to acknowledge the traditional custodians of the land from where I am presenting from today and pay my respects to their elders past and present. So quickly, just a bit of background about Dairy Australia. We are the national services body for the dairy industry. We're funded through a levy that farmers pay on their milk, and that money gets matched by the Commonwealth Government. Our funds are invested into a range of different research and development activities, including the work that we do in human health and nutrition. So our aim in the health and nutrition space at DA is to ensure dairy foods continue to be recognised as part of healthy and sustainable dietary patterns. So the work that we do is very much driven by the science. So we'll work with research institutes to generate science and contribute to the evidence base. We then take that science or science from other leading organisations and research groups, and we'll communicate that down to key opinion leaders, academics, policy setters, so people who are driving policy or regulation, or national or state-based guidelines like school canteen guidelines, for example. So anything that then influences the food environment or people's food choices. Health professionals, so dietitians and GPs, are a really key audience for us. They will then translate the policy and science into advice for their patients and the wider community. We also leverage them as trusted experts to speak to our consumer audiences and address any key concerns they might have around dairy. Healthy ageing with dairy is one of our key communication topics, and that has very much been led by the research from Dr. Sandra Giuliano and her team at Melbourne Uni. So over 10 years ago now, so well before I even started at Dairy Australia, Sandra and her team approached us with a research proposal looking at how improving the food in aged care using milk, cheese and yogurt could impact on the health of the residents. So they piloted the work, and they were able to show on a smaller scale that there was something really promising in providing dairy foods to older people. Unfortunately, your team really struggled to get funding from research funding bodies, very notoriously hard to acquire, but for us this was crazy because it's research with a really big, significant real-life impact. We wanted to invest in the study, and we sought collaboration from our international dairy organisations to co-fund this important research. So a number of publications have come out of the trial. There's a few more to come as well. So it's given us some excellent content and key messages. And so much so, this is why healthy ageing with dairy has become one of our really key communication pillars over the last couple of years. So very glad that we did invest in the study. There's some incredible stats that Sandy talked to earlier. It's not every day that we get to report on these type of stats. Increasing dairy from 2 to 3.5 serves results in a 46% reduction in hip fracture or 11% reduction in falls. So of course, we wanted to tell everyone and anyone who will listen about these fantastic numbers. It almost seems obvious that dairy foods are linked with better bone health because it's a message that we've been talking about for such a long time. But most studies haven't looked at the impact of food on fracture risk reduction. So they've looked at supplementation with individual nutrients, but not so much food. So no one had also embarked on a study of this type of quality or duration before. They may not again because it's so enormous and costly. So, I'm so glad that we have this work. So it's the first high quality study to link dairy foods and fracture risk reduction. One of the studies coming out from the work has shown that it is incredibly affordable. So in Australia, 66 cents a day to provide additional milk, cheese and yogurt. It was effective and it was safe. We're just using normal everyday food. Residents enjoyed the food. They ate it. So they obviously really loved it. It was tasty. It was delicious. And dairy foods are something that are really widely accessible and they're versatile as well. Can use them in a lot of different ways and in different recipes. So this study has given us, awesome communication opportunities. So promoting the health benefits of dairy foods to both people in the community and within aged care. It's given us really practical evidence to demonstrate dairy foods can be incorporated into aged care menus. And then evidence to then support food-based policy changes in aged care. We've got evidence to support dairy in dietary guidelines, so not only here in Australia, but also around the world. To bring to life this research, we've had two key objectives. So one's been about driving awareness that consumption of dairy foods in older adults reduces the risk of fractures and falls. And two, we wanted to drive change, so increase uptake of dairy food, not only within the aged care setting, but within the community as well. So we know intakes are really low in Australia. 99% of older adults aren't actually getting enough dairy food. So there's a really big opportunity here. So we have three key target audiences for this campaign, each with different comms objectives. So we've got adults, 65 plus, healthcare professionals, and also the aged care sector. So I'll cover off on our campaigns targeted at consumers, health professionals, and also the policy engagement space. So these campaigns do tend to target multiple audiences with tweaks in messaging or the creative approach. Following publication of the research in the British Medical Journal a couple of years ago now in 2021, we wanted to share the results with the media, and that generated 131 pieces of coverage in key media titles across health, news and lifestyle sectors, reaching over 8 million Australians. So that's something that we are really proud of. We then delivered a campaign to drive awareness of the importance of the research and inspire aged care reform and behaviour change in Australians. So the campaign targeting consumers, health professionals and key opinion leaders encourage older adults to consume more dairy to help prevent fractures and falls, so they don't stop doing the things they love. So I absolutely love this campaign. We brought it to life with some really fun characters like 89-year-old Fran who loves bowling at 89 because, dairy makes all the difference and gives her that energy to do so. The campaign included digital displays across radio, across media advertising, and also advertising in medical centres across Australia. So Dr. Sandra Giuliano, as a lead researcher of the work, has added a credible voice to our campaigns. She's done podcasts to GPs and dietitians. She's been a key voice in the media and a keynote speaker at aged care and dietitian conferences. She's so passionate about the research. Aside from leading the fracture work herself, she's had her parents in aged care, so she truly understands the space better than anyone. And we've been super lucky to have her as a key spokesperson. So to help give the message credibility, we appointed Maggie Beer, who is a very identifiable face here in Australia. She's a very well-known and much-loved identity. She's a cook, but she's also created the Maggie Beer Foundation, which is aimed to improve the food experience for older Australians. So she does do a lot of work, particularly with chefs in aged care, so teaching them how to make the food more delicious and more nutritious. So she was a really natural fit for our campaign. She participated in webinars with health professionals and provided content for consumers, including recipes and tips to increase dairy, and she voiced some of our radio ads as well. The trial has also given us some great content to support Healthy Bones Action Week, which is an initiative that's more than 20 years old and helps celebrate the role of dairy in supporting healthy bones. So each year we have a different target audience. In 2022, we introduced the Dairy Atrix, who are a group of Aussie seniors who are active and unstoppable thanks to their healthy high dairy diet. So the Dairy Atrix acted as campaign ambassadors, prompting consumers to double your dairy. It was a really strong campaign, so we had 380 pieces of coverage across TV, print, online and radio. We achieved a reach of over 3.1 million. We developed some posters for pharmacies and medical centres as well, and they were sent to over 95 clinics across Australia. So this year we focused on women 50 plus and a group called the Unstoppables, who are 50 and fitter than ever. So they were here to help Australians get the most out of life. The Unstoppables would engage in regular exercise, and this coupled with extra dairy meant they truly couldn't be stopped. And so we used our fractures messaging here to highlight the importance of getting enough dairy in every day. And 50 is also a time where our intakes actually increase, so they go from 2.5 to 4 serves. So that was another message that we wanted to make sure that consumers were aware of. So moving into the policy space, the research really clearly shows a real life impact for aged care residents. Our Australian government have increased their commitment to improving food and nutrition and the dining experience in residential aged care. We had a Royal Commission a couple of years ago which uncovered a lot of the issues with nutrition, and a significant amount of money has then been committed to improving it. For us, it's a real no-brainer that any kind of nutritional guidelines mandate dairy foods because of the research. So this inspired our policy phase of the work, which has been uncharted territory for us. So while we have long communicated about the importance of dairy foods and bone health, we hadn't before worked directly with the aged care sector. So we needed to do a bit of groundwork first to firstly understand the key players in the space, so the key stakeholders, the organisations, the individuals, and also think about our success measures. Secondly, we needed to develop some resources and accompanying materials for the work. And 3, rolling out the plan, so meeting with key stakeholders and organisations and engaging in conference activity. So we've had a couple of goals here. So firstly, we would love to encourage policy changes at a government level in the aged care space. So we would love to mandate nutritional requirements. Secondly, we would love to encourage internal policy changes for aged care providers and the catering companies and drive awareness of the social and financial benefits of increasing dairy. And finally, we really want to engage and inform key stakeholder groups, including health professionals and peak bodies representing older Australians, to promote the benefits of increased dairy consumption for older adults within the community. We have developed a number of resources to help support our work. So we've got fact sheets for aged care providers, older Australians. We've worked in conjunction with an aged care dietitian, Louise Murray, to develop a couple of guidebooks for how to actually increase dairy, whether you're an aged care facility or you're an older Australian. We've got some really delicious recipes showing how easy it is to increase dairy throughout your day. And we've got a Healthy Aging with Dairy web hub as well. And so if anyone does want any of these resources to, feel free to email me. I'm very happy to send out the work that we've done. For our policy engagement phase, we have presented at a number of key conferences, or Sandy's gone out and presented at a number of key conferences for us. We have met lots of different organisations and new people at dietitian conferences and aged care conferences. We've had a lot of meetings with key stakeholders to share the research and try to understand how we can better work together. And we've got a couple of key partnerships as well, Hello Leaders and Hello Care, which are aged care publications. So some great opportunities for us to share our resources and share the research and the findings. So this is a phase that we're very much still engaged in. It has probably been a lot harder than what we thought initially. I think aged care in Australia is a space where there are so many different players and so many different people trying to get change that it is really busy, and I think some stakeholders can feel quite overwhelmed by probably the scale of it. But definitely an area that we're still going to chip away at and hopefully see some really promising results soon. So finally, our Australian Dietary Guidelines are under review. They were first released in 2013 and finally now under review again, more than 10 years later. So the NHMRC or National Health and Medical Research Council, have committed funds to developing guidelines for older Australians as part of the wider review, which is really fantastic to see this population group be recognised for their separate nutritional needs. We do have a little while to wait. So the guidelines aren't due to be released until 2026. But we do hope there is an opportunity to submit the fractures research into this and make sure that dairy foods are well recognised for the role that they play in healthy ageing. So I have to give a shout out to the wonderful team that I work with. I certainly don't do this by myself. This work has very much been a cross-functional piece between marketing, communications, and our health and nutrition science team. So thank you so much for listening, and I look forward to joining you as part of the Q&A shortly. Thank you very much.